words from C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Noun, adjective. Exhaustion, exhausting. Fatigue, fatigate. Lethargy, lethargic. Tiredness, tired. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sorts. Present with, put on, warm out. Complete the sentence with the correct form of the verb present. A 67-year-old man presented with a 9-month history of increasing shortness of breath. The most common presentation is loss of consciousness. Cranial arteries may present as fever without any obvious causes. The patient usually presents with a severe sore throat. The presenting symptoms in this patient could perhaps be due to renal failure. Other conditions with a similar presentation include acute cholecystitis. Reduced groaning is an important presenting complaint of colic disease. 2 months following presentation, the patient was able to walk. Read the patient's describing of her symptoms, then complete the case report. Like C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired. But lately, I've been feeling completely worn out. At the end of the day, I'm not eating any more than usual, but I'm putting on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. A 50-year-old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her GP. Although she denied eating more than usual, she was constipated and she noticed that her hair had started to fall out. Find words in the box with opposite meanings. Look at B and C opposite to help you. Adequate, inadequate. Against, for. Unlikely, likely. Sudden and serious. Severe, mild. Rare, common. Make word combinations using a word from each box. Look at B and C opposite to help you. Bone marrow, differential diagnosis, and serious onset. Iron deficiency, pernicious anemia, progressively increasing, vibration sense. Complete the sentence. Look at A, B, and C opposite to help you. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. Blindness may be caused by a vitamin A deficiency. The bleeding and purpura are caused by abnormal platelet function. The white cells count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctiva is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia may be due to increased red cell breakdown. Complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so we didn't have the typical insidious. He doesn't have any skin onset polar, and he doesn't have insidious onset parasitic or absent symmetrical sense. And I couldn't feel his spleen. What about his tongue? His tongue was normal and not inflamed or vibration sense. Label the diaphragm using words from the box. Look at A opposite to help you. Number 1, skull. Number 2, jawbone. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number 7, shoulder blade. Number 3, spine. Number 8, thigh bone. Number 9, kneecap. Number 10, chin bone. Match the types of fracture with their descriptions. Look at B opposite to help you. We got open. A. There is a break in the skin. Comminuted. C. The bone is broken into several pieces. Displaced. D. The broken pieces are separated. Green stick. B. The bone is bent. It occurs mainly in children. And impacted. E. The broken pieces are pushed together. Complete the textbook, extract, look at, see opposite to help you. Reducing a fracture involves trying to return the bone to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will help, but it may go on to malignant. Table with words A and C opposite. Then complete the sentences with words from the table. Verb, nouns, adjective. Delay, delayed. Develop, development, developing. Distant, distension, distended. Fail, failure. Nourish, nourishment, nourishing. Number 1. Babies with the fetal alcohol syndrome may present with development to thrive. Abdominal distension may be due to an enlargement liver. A small amount of alcohol in pregnancy can affect fetal failure. Mortality from measles can be reduced by better nourishment. Delay in one or more of the milestones may be the first sign of disease. Complete the sentences. Look at A and C opposite to help you. After sitting, babies learn to crawling and then to walk. A child who has started eating solid food has been waning. Someone who is not very tall is cell to the sharp ester. The stages in child's development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Write the common English name from each disease using your medical knowledge. Enlarged parotid glands, mumps. Difficulty opening the mouth, logjá. Rash and enlargement posterior occipital nodes, German moles. Paroxysmal cough with vomiting, whooping cough. Pupils and vesicles, first and track, chickenpox. Cough and cold followed by rash, measles. Sore throat and rash, scarlet fever. Swollen joints and a heart murmur, rheumatic fever. Fever followed by muscle weakness, polio. Cough with stridor, growth. The table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Verb, noun. Inhibit, inhibition. Produce, production. Release, release. Replace, replacement. Secrete, secretion. Stimulate, stimulation. Complete the passage from a textbook using the illustration and your own knowledge. Look at B opposite to help you. Pulses of a GnRH, gonadotropin releasing hormone, are released from the hypothalamus and stimulate LH and FSH, released from the pituitary. LH stimulate testosterone secretion from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulate the Sertoli cells in the seminiferous tubulus to produce mature sperm and inhibits A and B. In heavy cases, feedback in the pituitary to decrease FSH secretion. Complete the sentences. Liquid A and C opposite to help you. A diffuse change affects many parts of an organ or gland. A liquidated change affects only one part. His diet is deficient in iron. He doesn't get enough iron. And number four, we can have excess or both. T3 and T4 increase the basal metabolic rate. Match Mr. Davis' symptoms with the questions your doctor asked, like D opposite to help you. Diarrhea. We got. Okay? Number 1, diarrhea. D. Are your bowels normal? Number 2, eating more. What is your appetite like? Number 3, heat intolerance. Do you prefer hot weather or cold? Number 4, overactivity. Are you able to sit and relax? Number 5, palpitations. Have you ever felt your heart beating rapidly or irregularly? Number 6, weight loss. Is your weight steady? Number 7, tumor. Do you hence take? The table with words from be opposite and related forms. Verb, noun, adjective. Accommodate, accommodation. Constrict, constriction, constricted. Converge, convergence. Dilated, dilatation, dilation. Dilated. Drop, dropping. Oscillated, oscillation. React, reaction. Match the pictures 1-6 with the conditions AF. Let it be opposite to help you. So we got number 1 is squint. Number 2 is irregular pupil. Number 3 is dilated pupil. Number 4, it's constricted pupils. Number 5 is cataract, and number 6 is dropping of lids. Complete the extracts from a textbook. Look at C opposite to help you. Rhinotoscopy. Examine the retina with an ophthalmoscope is possible with the pupil dilated to obtain the maximum view. Look for papilledema and for flame-shaped hemorrhages and cotton wool exudates. Assess the state of the arteries and note the presence of any narrowing, as well as heaping and arteriovenous crossings. Case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 88 Celsius, pulse 100 per minute, blood pressure 110 per 80 millimeter for mercury. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant, and was associated with quadrant but not rigidity. There was not rebound tenderness, and no masses were felt. Vowel sounds were reduced. Match the descriptions of the tools 1 to 6 with the condition most likely to cause them. A to F using your medical knowledge. Look at B opposite to help you. We got type of tools, condition. Loose, bloody, ulcerative colitis. Loose, pale, bulky. Colitic disease. Clay, colored, obstructive jaundice. Black tarry, gastric ulcer. Small, hard, irritated bowel syndrome, clear, watery, and mucus, cholera. Match the features to the doctor's questions. Like it be opposite to help you. Blood. Have you passed black stools? Bowel habit. How often do you open your bowels? Change in bowel habit. Are you going to the toilet more often than normal? Bulk. Is the size or the amount of the stool normal? Color. What about the appearance of the tools? Consistency. Let's see. Are the motions hard or loose? Offensiveness. And do the motions have an unusual smells? Oh well. We got right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. The abdomen can be divided in 4 quadrants. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy, removal of the womb, surgical. Hemorrhagia, heavy period. Salpingitis, inflammation of one of the tubes that the neck of the ovary to the womb. Cervical biopsy, biopsy of a small piece of tissue removal from the neck of the womb. Read the conversation between the gynecologist and the patient. See opposite and complete the notes about the patient. Menarche, 12 years. Menstrual cycle, 4 or 5 days. LMP, 2/52. Hemorrhagia, no. Dysmenorrhea, no. Discharge, a little. Color white. Now write the questions that the doctor asked. Look at C opposite to help you. Menarche, how old were you when you started to get them? Menstrual cycle, how long do the periods last usually? LMP, when was your last period? Menorrhagia, would you say they are light or heavy? Do you get clots? Dysmenorrhea, do you get periods pain? Discharge, is there any discharge between the periods? What color is it? Complete the case report. One word is needed twice. Look at B and C opposite to help you. A 45-year-old woman had been having prolonged periods lasting for 8 days with the passage of clots for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was filled. She had a normal pregnancy when she was 25. We got a diaphragm, EUD, condoms, and copper coil. And the case history and B opposite. Doctor, what seems to be the problem? Patient, I have been getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I had hair problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a mitral valve replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, cardiac output, heart failure, and effort, putting oedema, premature beats. Write the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help you. Dysphonia, breathlessness, shortness of breath, arrhythmia, palpitations, orthophonia, breathlessness when lying flat, oedema, swelling. Complete the case report. Look at A, B, and C opposite to help you. A 60-year-old woman attended her GP surgery complaining of breathlessness and effort. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was not history of chest pain. She had had several episodes of fast palpitations which last 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling on her ankles. By the end of the day, this disappeared overnight. From A opposite, put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, noun. Auscultate, auscultation, examine, examination, inspect, inspection, palpate, palpitation, percurse, persecution. Put the steps for examining the heart and circulation in order according to the 4-stage system. Look at A opposite to help you. We got number 1, look for clothing, inspection. Number 2, feel the radial pulse. Number 3, locate the apex set. Then number 4, note any thrills. Number 5, measure the heart size. And number 6, are there any murmurs? A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was preaxial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130 per /80 and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present and there was not central or peripheral cyanosis. Her apex beat was displaced to the arterial axillary line but still in the 50 intercostal space. Her heart sounds were interesting. When she was initially examined, it was noted that she had pansystolic and mild diastolic murmurs, heard best at the apex. When she was examined some hours later, there was a rash pericardial friction rub all over the pericardium. Our diagnosis at the time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Thank you.